Welcome to the deep dive. Today we're jumping into something pretty specific in pet health.
Hmm,
These things called leiomyomas in the GI tracts of dogs and cats too.
that's right.
We've got some excerpts here from veterinary texts basically giving us the rundown.
hmm
Our aim is really to pull out what you need to know. What are they? Who gets them? How do we spot them? And what can be done?
Trying not to get too lost in the medical jargon.
Exactly. We're talking about leiomyomas. They're uncommon tumors, thankfully benign, non-cancerous. They start in the smooth muscle tissue of the stomach or the intestines.
Yeah.
But here's a really interesting point sometimes with more advanced testing, like immunohistochemistry.
Yeah, fancy term there.
Yeah, it is. But it basically means looking closer at the cells. And sometimes these leiomyomas get reclassified as GIST, that's gastrointestinal stromal tumors, or something very similar.
So not always straightforward then.
Not always. What looks like one thing might, have another layer to it with deeper testing.
Gotcha. So who are we typically seeing these in? Which pets? Well, we definitely see them more often in dogs compared to cats. And it's usually middle-aged to older pets, think over 6 years old.
Any particular breeds?
Surprisingly, no. There isn't a specific breed that seems to be more likely to get them, which is interesting in itself.
Yeah, that is. So, okay, if a dog or cat does have one, what signs might the owner actually see at home?
It really, it depends heavily on where the tumor is located.
Makes sense.
If it's in the stomach, the big sign is usually vomiting, just vomiting.
Okay.
If it's lower down in the small intestine, you might still get vomiting, but also maybe weight loss. You might notice louder stomach gurgling sounds.
Borborygmus.
That's the one, yeah, borborygmus. And maybe more gas, like flatulence.
Right. And what about even further down? Large intestine.
Yeah, if it's in the large intestine or the rectum, then the signs change again. You might see straining to poop, that's tenesmus, or maybe blood in the stool, which we call hematochezia. Sometimes, though less common, even a rectal prolapse.
Wow. Okay. So quite a range depending on location. When they get to the vet, what might be found on an exam? Is it obvious?
It can be pretty subtle, actually, especially if it's early on or if the tumor's in the stomach or a small intestine. A regular physical exam might feel completely normal.
Hmm.
But in some cases, yeah, the vet might be able to feel a mass in the abdomen or maybe during a rectal exam if it's located back there.
So finding it can be a bit tricky. How do vets actually, nail the diagnosis?
Right. So the first steps are usually routine blood tests and a urinalysis. Often these come back perfectly normal,
Okay.
but sometimes we do see clues like low blood sugar, hypoglycemia, or signs of iron deficiency anemia. That might point towards something going on, especially with stomach or small intestine tumors.
And then imaging, I assume.
Absolutely. Imaging is key. Abdominal ultrasound is really useful. It can show thickening in the wall of the stomach or intestine. And there's a common spot right where the esophagus meets the stomach.
The gastroesophageal junction.
Exactly. Contrast radiography, like using barium, can also help outline masses.
What about things like endoscopy? Getting a camera down there for biopsies.
Yeah, that's often less helpful than you'd think for these specific tumors.
Why is that?
Because leiomyomas tend to be deep. They're often in the muscle layers, not right on the surface lining that the scope sees. So those little pinch biopsies you get with endoscopy often miss the actual tumor tissue.
So they might come back normal, even if the tumor's there.
They might, or they might just show inflammation. So while we might do fine needle aspirates, sticking a needle in to rule out other things like lymphoma, they aren't super reliable for diagnosing leiomyomas definitively. Meaning, often you really need a surgical biopsy, taking a larger piece during surgery to be sure.
Okay, that makes sense.
Yeah.
So let's say we've got the diagnosis confirmed. What's the treatment plan?
Surgery, surgical removal resection is really the treatment of choice. And the good news is it can often be curative if the entire tumor can be removed successfully.
That's encouraging, even for big ones.
Yeah, actually, even quite large leiomyomas can often be taken out completely, sometimes even if the margins, the bit of normal tissue around it, are quite narrow.
That's great news. Are there other treatments considered? You mentioned that GIST reclassification earlier.
Right. So if that further testing happens and the tumor is reclassified as a GIST, then yes, other options might come into play. Specifically, a type of targeted medication called a tyrosine kinase inhibitor. Tosarenib phosphate is the common one.
Okay, so that's more for the GFC situation.
Primarily, yes, as a potential follow-up therapy after surgery in those cases.
And after the surgery, assuming it went well and it was a regular leiomyoma, what's the follow-up like?
Generally, if the tumor is completely removed, it's just standard postoperative care. making sure they recover well from the anesthesia and surgery. There isn't usually a need for specific long-term monitoring for the tumor itself.
Any exceptions?
Well, the main one would be if the pet had that low blood sugar, the hypoglycemia, before surgery. In that case, we definitely want to monitor their blood glucose levels afterwards to make sure they return to normal.
Okay, so wrapping this up, the key takeaway seems to be leiomyomas. Not super common, but it's good to know the signs. And importantly, surgery is often very effective, even curative.
Exactly. That's the main message. It's manageable, often successfully, with surgery.
And it does bring up that interesting point you made earlier.
Right. The idea that something seemingly benign like a leiomyoma could potentially be reclassified as a GIST with more testing.
Yeah.
It makes you think, doesn't it? How might our understanding and maybe even treatment of other conditions evolve as our diagnostic tools just keep getting better and more sophisticated? We might find more layers to things we thought were simple.
That is definitely something interesting to mull over. Thanks for walking us through this today.
My pleasure.